లోక్సభలో పురంధేశ్వరి మాట్లాడుతున్నారు. ఇప్పుడు లైవ్ చూద్దాం.
An area of concern for us, sir. I have been listening to my colleagues when they have been saying that very little has been allocated for mental health. Sir, there has been an increase from 63 crores to 90 crores when it comes to mental health. I do agree, sir, given into the fact that there's a lot of psychological pressure on our children when it comes to neutral families, the after effects of COVID, and also, if I may say, the drug addiction that we see in the country. I think this increase in allocation is welcome, though we desire that a lot more should be done in this direction. Sir, digital UWin is a wonderful intervention, sir, where people largely who are migrating, we have a lot of migrant force, and when they are migrating, they do not have to carry their physical records, but they have it all stored in a digital portal, and wherever they go, for them to access them would be very easy, and the medical records are safe, and this is assuring the entire country that it is also kept confidential. So the digital UWin is really welcome. Sir, the increase of 4% for research is very, very important in our country today, because we see an increase of non-communicable diseases, and even as I speak, we are also hearing of new diseases that are coming in the form of Nipah and so on and so forth, and therefore we need to really increase our allocations for research to ensure that we are able and capable to face such challenges that come up. Needless to say, the other interventions in the medical sector as well, and therefore, sir, the increase in allocation for research is really welcome, sir. Sir, having said that, we need to also look at the interim budget, the provisions in the interim budget, even as we look at the provisions in the budget itself. Sir, in the interim budget, there has been mention that Ayushman Bharat would today be extended to Anganwadi workers, Asha workers, and other workers at the Anganwadis, and also senior citizens who are 70 plus. Sir, today we have, even as we talk of our demographic dividend, we have longevity that has increased in our country, and where we were talking about 62, 65 years, today we are talking about 72 to 75 years of longevity. So keeping that in mind, sir, geriatrics has been a very, very neglected section when it comes to the health sector. So keeping that in mind, sir, I think extending the Ayushman Bharat cards to 70 plus senior citizens is rather very welcome, and would support them even in their even at the older ages. Sir, I was also listening to many of my colleagues who were talking about setting up of tertiary hospitals like AIMS, where the number of AIMS have increased, but the speed at which the construction should happen has not been happening. Sir, but we need to also keep in mind that state governments, as their share, would have to provide the infrastructure, wherein largely when it comes to our own AIMS in Mangalagiri in Andhra Pradesh, there had been an inordinate delay in construction of AIMS because the state government would not remove the high tension wires from this site or remove the electrical